Hemisected female pelvis, bird's eye view. So sacral promontory up here. For the vessels that can be identified, we have the common iliac vein right there, common iliac artery, external iliac, internal iliac arteries. For the organs of the female pelvis, we have the uterus here. You can see the uterine cavity lined by the uterine endometrium, and that will be the uterine cervix, and you can see the vaginal canal. So behind that, we would be the sigmoid colon, part of the sigmoid colon, and then we have part of the rectum, the rectal vault right here, and you have the anal canal down there. So this will be the urinary bladder, the space right between the rectum and the uterus, that is called the recto-uterine pouch, or the pouch of Douglas, which is clinically important in females rather. So if there's a problem in the pelvis, you have fluid, increased peritoneal fluid, we can actually collect peritoneal fluid sample from the pouch of Douglas through the vagina. The procedure is called culdocentesis. So other structures of the female pelvis, we have the ovary right there. This one would be the fallopian tube. This finger-like projections at the end of the fallopian tube would be the fimbriae. The dilated funnel-shaped segment of the tube right next to after the fimbriae, we can call it is called the infundibulum. And then greater length of the fallopian tube is called the ampulla, while this segment connected to the uterus, that is the isthmus. The fallopian tube is known by many names. We can also call that the oviduct, or the uterine tube. So once again, this will be the internal iliac artery, anterior division right there. Anterior division, which is the origin of the umbilical artery. This part right here is the proximal segment of the umbilical artery. That segment is not obliterated. It continues anteriorly up to this part right here. So the non-obliterated segment of the umbilical artery will be the origin for the superior vesical artery, which is the blood supply to the urinary bladder. This segment right here is obliterated, but in the fetus that will function as the umbilical artery. It will continue going towards the anterior abdominal wall, and it will be enclosed as part of the medial umbilical ligament, or medial umbilical fold. The other vessel right there, that is branch coming from the external iliac, branch of the external iliac to the anterior abdominal wall. So that will be the inferior epigastric artery, which is contained as part of the lateral umbilical fold. Then we have, let's move back to the internal iliac here. The next branch will be obturator. And then this will be the uterine artery, blood supply to the uterus. This again is the ovary. You can see the ovarian ligament right there, no? Connecting the ovary to the uterus. This nerve right here is the obturator nerve. It will course alongside the obturator artery in its more distal segment. Then this one, that's the ureter, the left ureter. This bundle of vessels right here, that will be the gonadal or ovarian vessels, artery and vein. Ovarian artery is coming from the abdominal aorta. So this one, that thick blood vessel right there, that's external iliac vein. You can see it's running alongside the external iliac artery. Then we have the symphysis pubis in this area right here.